Hello and welcome to the COVID-19 update for the town of Pembroke. We're recording this episode on January 19th, 2022. My name is Donna Rodriguez. I am your host for today, and I am joined by both Bill Chenard, town manager for the town of Pembroke, as well as Lisa Cullity, who is the health agent for the town of Pembroke. Thank you both for being here with us today.
Thank you.
Now,
my pleasure.
There's so much information right now. I think since the beginning of COVID in 2020, this is a period of time where so much is coming out on a daily basis. We think it's really important to be able to get information out that's really hyper-local to residents. So it's so important to be able to offer these shows. I'd like to start first with you, Lisa. If you can just give us an update. I understand there was an update from the state yesterday, so we can just get a sense of where things stand right now for the town of Pembroke.
Certainly. So most people would comment that this has been going on for a very long time, and they would be appropriate in saying that. So the frustration that's being expressed is, well, when is this all going to be over? But just like it didn't start with a splash, it's not going to end with a splash. So one of the things that was covered in yesterday's state phone call was, when is COVID over? When is the pandemic going to be an endemic? And the state pretty much said, well, it already is. COVID is here to stay. We are going to be dealing with it in some format, a seasonal flu from time to time. And when do we stop responding in an emergency type mode? Well, we already are on some levels, but part of the emergency problem that still continues is the fact that because COVID is working its way through the population with really high case counts of positivity, myself included, that many sectors, government, mass transportation, food, private industry, are all dealing with major staffing reductions because of it. So all of those complications still keep us in an emergency type of mode as far as COVID goes, and you still want to be healthy and safe and protect yourself. Yet we are seeing that return to normality where, again, those quarantine periods are being lessened. Contact tracing is pretty much over and being lessened. And that's where we're going to move. So people are going to see a continued reduction in all of those things. And I think that's going to lead to, quote unquote, seeing the end or return to some sort of form of normal as people would consider it.
And I think being in this transitional period where there is just so much information coming out and adjustments and changes as we go from thinking of this as a pandemic to an endemic, as you identified, that it's important for people to really stay up to date on all of the information. Where would you recommend people go to get the most up-to-date information on a regular basis?
Absolutely, mass.gov. I know a lot of people watch the CDC, and that's great for informational purposes. But as I constantly remind people, the CDC recommends guidance, then the federal government adopts it, and then the states either adopt it or don't, depending on what works for any individual state. So if you want to know what's going on in Massachusetts and what's appropriate for Massachusetts, as well as Massachusetts case numbers, you always want to go to mass.gov for that. And keep in mind that, as new information comes out, it will take the state a day or two to digest that information and respond with updating the state guidance. And then, of course, they have to update the cities and towns. So if you kind of want to really have your finger on the pulse of Massachusetts, mass.gov is where you want to be for that information.
Excellent. Thank you so much. And Bill, I'd like to come to you now. Can you talk a little bit about, again, as Lisa was saying that things are changing quickly, and mass.gov is the first place for us to go to get local information for the state. It does take a couple of days for everything to translate from what we might see or hear in the news to guidance and then come to our towns. Can you talk to us a little bit about some of the confusion and where things stand right now for the town of Pembroke and what guidelines are today?
Sure. So a lot of people are confused about what to do if you do test positive or if you have, exposed to someone that is positive for COVID-19. The rules have recently changed, and I think it's important that we just go over what those are. So if you do test positive for COVID-19, you need to isolate, and that means everybody, regardless of your vaccination status. So, I've been, fully vaccinated, as are most of our town employees. It doesn't mean that we still don't have to isolate. So if you test positive, stay home for 5 days. And then if you have no symptoms or your symptoms are resolved after 5 days, you can then leave your house. You should continue to wear a mask for, an additional 5 days. However, if you have a fever, or your symptoms are still strong after 5 days, you should continue to stay home until the fever resolves. If you were exposed to someone with COVID-19, you should still quarantine. If you've been boosted, or the primary series of Pfizer or Moderna, which are the two where you get 2 shots, have been within the last 6 months, or the J&J within the last 2 months, wear a mask for 10 days. And then if possible, they're recommending that you test on day 5. If you do develop symptoms, stay home and get a test if you can. If this, generally speaking, with the Omicron variant, we're finding that most people have mild symptoms, like a cold, runny nose, sore throat type of thing. However, if you do have comorbidities and your symptoms worsen, you should seek assistance from your physician. We recommend that you talk to your doctor. The hospitals, are saying if you have mild symptoms, don't go to the hospital unless your symptoms get worse. The second part of that is the quarantine protocols. If you completed your primary series over 6 months ago and have not been boosted, or if you did the J&J over 2 months ago and have not been boosted, or if you're unvaccinated, you should act as if you were positive. So stay home for 5 days, continue to wear a mask around others for an additional 5 days. If you can't quarantine, and we strongly recommend that you do, you should wear a mask for 10 days and then again test on day 5 if possible. If you do get symptoms, then please follow the protocols as if you had the virus. We're trying to stem this. We're really, really good in the town of Pembroke with our numbers for vaccinations and boosters. Those who are eligible for a booster seem to be getting out there and getting them. People over age 65, we're at almost 98% overall with fully vaccinated, and then almost 68% for boosters. Obviously, the younger age groups, the booster numbers aren't there because they're not eligible for boosters yet. Many of them just became eligible for the vaccination. So, that's a really number for us. It's going to help keep us in a safe mode. For the town of Pembroke, I just want to emphasize that our meetings are remote, our public meetings. However, it doesn't mean you can't participate in the meeting. Go to our website, pembroke-ma.gov, and it will let you write in there and click on the meeting section from the main page and sign up for our meetings. We encourage people to participate. I know there's some information out there where people are saying that they can't participate. You absolutely can participate, and we are strongly encouraging that. Town hall, because we had a bit of an outbreak here in some of our departments, we've gone to by appointment only. Again, it doesn't mean you can't visit town hall. You certainly can visit town hall. We just ask that you call ahead of time and notify the department that you're coming. Try to make an appointment so that we can keep all of our employees and our citizens safe.
Thank you so much. And Bill, people can get not only information, but they can register for vaccines. They can register for tests, all on mass.gov/COVID-19. And if you just go to the main website for the state, mass.gov, you'll see right at the upper right-hand corner a tab for COVID-19. So you can get information about testing, information about where your town stands at this point, information about being able to get vaccinations or also get boosters, as well as some of the protocols. So everything is right there in one space. I've also noticed that pembroke.ma.gov has been really wonderful in providing updated information specific to the town of Pembroke. So we encourage people to continue to visit both of those sites. It's really a one-stop to get all of the information that you need. Now, Lisa, can we come back to you? I'd like you to just talk to us a little bit about what the trends are currently in the town of Pembroke, and then we can go from there to maybe start talking about the schools a little bit.
Sure. So obviously we had a spike, as did the entire Commonwealth, as did the entire country. Mm-hmm. It does seem to be trending in the right direction now. I do think it's going to move through its population. That's what viruses, flu, or anything else is going to do. So I don't think we're out of it. I think we're still going to see a very high number of cases. And for everyone, that means taking a deep breath and understand we're going to see more kids out of school. We're going to see more child care centers have some challenges, both staffing and with the population. And we're going to see some businesses with those population challenges as well. So I think we just have to be patient, be diligent. If you're sick, stay home. That's the important thing. And then move forward from there. Now, as far as these new regulations, I think it's going to take some time before the school committee and the school system has the time to process all this new information. Obviously, DESE is going to have some announcements and some reactions to this new information. So I think it's going to be important to give them time to digest that as a school district, and then they will come out with guidance. I'm sure I will be talking to school committee members and the superintendent about those as far as how to move forward and what their recommendations might be.
And for folks who are watching this around the time that it's being recorded on January 19th, some of the information that's come out most recently is from the state level with the governor recommending potentially making some changes town by town in which towns choose to sign on for test and stay or for options for at-home testing. Is that correct?
Yes, and I think it's going to depend on the incidence of cases within the community and the indices of vaccination. Excuse me, I apologize. So what that means is simply if there's enough children vaccinated and the school district can work with the test at home program, I think that's going to be on a case by case basis. And I think that's going to depend on the school districts, as well as the population they serve to make an educated decision for that district.
And speaking of testing, one of the concerns that people have been expressing recently is being able to get access to at-home testing. And the federal government announced just yesterday on January 18th an option for folks to be able to register to have home tests sent to them directly, and that's covidtests.gov. Now,
yes, and people can sign up there, and it's 4 tests per household. So you just go and you sign in. It's very easy. I've already done it. You put in your name, you put in your address, and they let you know there'll be a significant delay. These are not going to ship tomorrow. I believe the message I got when I signed in was it would be anywhere from a week to 2 weeks for those to ship, and then I would be sent a tracking number, and they would come to my household. So that's one great avenue. The other thing is I would recommend people when it comes to test kits, just be persistent and patient. Most CVSs, most drugstores, I only say CVS because that's what we have here in Pembroke, but they are getting routine shipments of these tests. And I think you just have to keep checking back and you will be able to get some of those kits.
And online too, I've had personally a great success with being able to order small amounts on a regular basis. So I order 3 or 4 kits a week, and so we have a regular amount coming in just to make sure that we have them available for our children as well as, for 2 adults in the household who work. Now, could you talk a little bit about within the family? And you've had experience recently as well within the family. Yes, unfortunately, I'm sorry, but being able to keep everybody safe, and it is possible in some instances to be able to avoid transmission within a home.
So what we're seeing statistically speaking is, unfortunately, homes with young children, it's just about impossible. Young children, excuse me, require hands-on assistance. And so the homes with young children that require hands-on assistance from their parents, it's almost impossible to keep COVID from spreading through that household. Also, households that are very dense, in other words, a very high number of people living in a smaller or medium-sized home, are also going to have that challenge of isolating successfully to make sure that other people in the household don't get sick. Overwhelmingly, once it's in a household, we see most of that household come up positive. However, in my personal circumstance, unfortunately, I did test positive. I did become fully symptomatic, even though I am vaccinated and boosted. It was basically the equivalent for me of a bad cold. Now, my husband works for the MBTA, and the MBTA is already facing a massive employee shortage. And my husband, of course, is fully vaccinated. So what he did is he simply took a test frequently and to make sure that it was safe for him to go to work. What we did in our household is we completely separated. When I mean completely separate, I mean completely. I was in a separate bedroom, separate bathroom. The 2 of us weren't even in the same room at any given time together at all, period. And I did wear a mask, and I did not go roaming about the house. The house was, if you would, kind of his domain. I pretty much sequestered myself in a room, and we were successful. He took about 3 different tests over that period of time, and none of them came up positive. So it can be done. It does require an extreme level of diligence, and it does require literally having no contact. Like I said, we had no contact for a solid week, and he was able to remain healthy, and we're very thankful for that.
And even within households that don't have the option of being completely separated, wearing masks, good hygiene, not sharing utensils, food, and making sure that bathrooms are cleaned and sanitized in between use, all of those things can help to cut down on the chance of transmission, correct?
Very much so. And also whoever's preparing food, again, don't have the person that is sick within the household preparing the food. Everyone might have to prepare their own thing or deal with the TV dinner or takeout or something. But again, you can't have people interacting at all, because when you do, that's when those problems are going to occur.
Okay, thank you so much. And again, there's a lot of information out there. It can be overwhelming. Keep where you're going very reliable and straightforward. So again, we look at mass.gov for general information statewide. We look at pembroke-ma.gov for local information, and also for the schools, we please look at pembroke-k12.org. Bill, to come to you, can you talk a little bit about, or actually you and Lisa, can you talk a little bit about what you're hearing from the schools right now in Pembroke? I know that the guidelines through DESE, masks are required and extended through the end of February. So people are looking at this as not as a long-term semester, but looking at it month to month to see where things stand in the schools.
Yeah, so obviously the schools have had some numbers. They post their numbers on their dashboard, on their website on a regular basis, daily, as a matter of fact. We're not as bad as some communities, but the schools have done a very good job with making sure that the protocols are followed, that the schools are cleaned on a regular basis and sanitized. There is still the mask requirement, as you alluded to, through the end of February. I'm sure that DESE will be evaluating that as we move forward. And I think what we're starting to see is the numbers statewide in the schools are starting to reach a peak. I'm not sure they're there yet. When we start to look at those numbers, they're still coming in on a regular basis. So, but I think very soon the experts are telling us that we're likely to reach a peak and start to subside. It's not going to go away. We're going to need to learn to live with it. I know that there was a news story yesterday that the vaccinations, they're going to try to look at, combining it with the annual flu vaccine, and so that, we get vaccinated on an annual basis for the COVID. So we're just going to need to learn to live with it. And I know the schools are doing a very good job with that.
And as you said, from what we're hearing, everything indicates that we are reaching a peak in Massachusetts, and hopefully we'll be coming back down. Reports have been telling us for a week that through Deer Island, even though that's Boston and 22 surrounding communities, north and south, that they're seeing levels of infection decrease dramatically over the last 7 days. And that has been a good indicator historically throughout this pandemic of when numbers will increase or decrease. So we have things to be hopeful for and look forward to moving forward. One of the other changes I just wanted to, one of the new options for folks I wanted to bring up as well, is for anybody who has been vaccinated or have family members, children who have been vaccinated, you can have access to your vaccination records on the state website now, or on a specific state website now, and also be able to save those to your phone to be able to share those with others, because there is more, or we're seeing increased need to be able to have access and share our vaccination records. So if you go to myvax, vaxrecords.mass.gov, you can sign in with either your email address or your phone number to be able to have access to your records, as well as any of your family members who you signed up in the process for vaccinations. as we're finishing up this episode, I'd like to ask each of you if you have any final comments or information you'd like to share. Lisa, we'll start with you and then we'll move to Bill.
Certainly. The one thing I will share is just remain diligent, that this, like any disease, can be, serious and fatal, or it can be mild if you give yourself all the proper medical advantages that are available to you. So, in that sense, it's a personal choice, but I would just remind people that unfortunately, when it comes to diseases, you can share them with others. So you do have a little bit of responsibility beyond your own person there. And please think about that. Please think about the safety of your children. Please think about the safety of the children around your children when you're making those kinds of decisions about what kind of behaviors you're going to engage in and what kind of activities and things like that. So keep that foremost in your mind. The other thing is just be kind to each other. Be kind in the businesses that you frequent. Be kind when dealing with municipal government. I mean, we're at least 2 to 3 weeks behind where we would normally be in the Board of Health. You can't have your staff get wiped out, so to speak, and not experience the shortages and delays. So just keep that in mind, that this is not an active thing of state government, local government, or businesses that you frequent trying to, just not do things. There's not an aspect of industry that I am not aware of having faced these challenges. So just try to take it with a grain of salt and just a tiny bit of patience, and I think it'll go a long way.
Excellent. That's wonderful advice, Lisa. Thank you so much. Bill, do you have any final comments for our audience?
Yeah, just one thing. I think it's important that everybody take personal responsibility. We are going to learn to live with it, and hopefully with Omicron, it will get us to the point where I know herd immunity is a term that's thrown out that the scientists will say, well, you shouldn't use that term, but we'll get us to that point where with the number of infections and the number of vaccinations, that it will limit the exposure for people. So be patient. I will second what Lisa said, be kind to your neighbors and those who are providing service in the industry. It can be challenging. I know with Omicron, we've had that hit here in Town Hall where we've had complete departments shut down, where others have stepped in to do that. So we will get through it. Take a breath. I use that term quite frequently when things are stressed. But I think if we take a breath and just work our way through it, we'll all be fine.
Thank you so much. I think all of your advice is incredible. Be aware, be kind, and be patient. And remember that we're all in this together and working through this together. For those of you who are watching, if you'd like to see this episode again, you can visit Comcast Channel 15 in the Town of Pembroke for the government channel. Also, you can visit PACTV.org, video on demand, to be able to watch this online. And if you would like to view this on YouTube, you can also visit the PACTV video share, and you will see a listing of the COVID-19 episodes. For PACTV for the Town of Pembroke, I'm Donna Rodriguez. Thank you for joining us for this COVID-19 update.